So Dr. Cripe, is it true that women that don't have a family history of breast cancer are not at risk? Is that
That's
true?
actually not true. That's a myth. The majority of women that will develop breast cancer do not have a family history of breast cancer. Only about 5 to 10% are hereditary or familial. So 1 in 8 women will develop a breast cancer, most without having a family history.
Wow. Okay. Thank you. Dr. Halaharvi, underarm antiperspirants and underwire bras and things like this. Is that a cause? Is that a risk for cancer?
So we don't really have good studies to show that underarm perspirants, deodorants can cause breast cancer. I do tell my daughter, who's a teenager, to look at the ingredients, and if there is aluminum in it, I would tell her to avoid that. But we just don't have good data to say don't use it. The underwire bras, there's no link to that with breast cancer. What underwire bras can do is cause pain, like chest wall pain. There's a condition called costochondritis, which is just essentially pain in the rib region where it connects to the cartilage. And so patients will then think they have breast pain, but that sometimes can happen because of the underwire bras.
And breast cancer does kill more women than any other disease. That's true?
No, that's actually not true.
False.
So the leading killer of women is still heart disease. I think breast cancer gets some more publicity that's out there, especially in October. It's Breast Cancer Awareness Month. We want people to check themselves. However, the leading killer of women is still heart disease. We want people to be exercising and stay fit and healthy.
Okay. So so mammograms, are they safe? I mean, it is radiation, right?
Yeah.
Are they safe? Are they painful?
I mean, so it can be painful, but it's temporary. In terms of safety, you get more radiation like going from here to California than you actually get from a mammogram.
Wow.
So yeah, mammograms are very safe. And it's very highly recommended for women who are average risk, meaning don't have strong family history of breast cancer, to start at age 40. If you have family history of breast cancer, you want to start 10 years younger than your family members. So
okay. Yes, if you get your mammogram and it comes back normal, then you're good for the year, right? Get them yearly and
we do like annual mammography.
Yeah.
We do like that. But even if it's normal and you feel a mass, you want to get that worked up. So you have a number of patients with what we call mammographically occult, meaning you get a mammogram and they don't see it, but yet you have a cancer there. Unfortunately, that happened with my wife, where she had a normal mammogram. I felt a mass, and it was cancer. So if you're feeling something that's abnormal, unusual, don't let a normal mammogram stop you from seeking help. And that's where ultrasound or other imaging technologies, ultimately a biopsy will be recommended if you feel something that's suspicious.
And so you get that biopsy, and if it is found to be cancerous, then pretty much you just have to have a mastectomy, right?
No, actually that's a myth. So I think that's another benefit of getting mammograms every year. Mammograms do catch cancer when it's much smaller, so women can have what we call lumpectomy, meaning just removing the lump and a little bit of ridge of normal tissue around it. So, and also it allows women to maybe avoid chemotherapy. If you have a lumpectomy, typically with cancer you need radiation, but early stage, smaller tumors, less invasive surgeries, and less treatments. So it's good to get a mammogram every year.
Okay. Do you have any male patients, or just women get breast cancer?
Well,
Guys can
get breast cancer as well, correct. So it's not just women that develop breast cancer. Women will develop more commonly or more often a breast cancer than a man, but males still can get breast cancer. That can also be seen in certain genetic mutations where guys might be at a little higher risk than other general population guys. But if you feel a mass, if you have a nipple discharge or the nipple is pulling in, as a guy, you still want to seek medical help. And guys will unfortunately get breast cancer.
Wow. Okay.
Just not as frequently.
Something that I've learned recently is dense breasts, breast density.
Yeah.
How does that correlate to breast cancer?
Yeah, that's a really great question. So what is dense breast? So dense breast is for these women who have more glandular tissue than fatty tissue. So it looks white on a mammogram. Cancer looks white on a mammogram. Sometimes cancer can hide in the dense breast tissue. The other problem with dense breast tissue is that it also increases your risk of getting a mammogram. So if you know that you have dense breast tissue, and 38 states in the United States actually mandate the radiologist to say that in the letter that you get when you get your mammogram. And in Ohio, we just have the House Bill 371 that just got passed. And basically Governor Mike DeWine signed it. And what that means is for these women who have dense breast tissue, it requires the insurance companies to pay for additional screening recommendations, like in screening ultrasound or abbreviated MRI if your institution has that.
Okay.
Yeah.
And I think that a mammographically dense breast tissue is different than a palpatory
Yes.
dense
Yeah.
breast tissue. So if you're feeling thick breast tissue, that's different than mammographically dense
Yeah.
breast
Ah,
tissue,
that's a good
which
point.
is what we're worried about.
Okay.
Yeah.
Yep.
Just something new that
Yeah.
Yes.
I've learned along the way.
Yeah.
We always gonna learn stuff, right?
Yeah.
Exactly.
Never ends.
Yeah.
Exactly.
I have a question for you. If someone
ma'am.
has a normal mammogram, do you think they can avoid doing breast exams?
No.
Okay.
No.
That's a good answer.
Good job. All
Good job.
right.
No,
Good job.
no, you have to.
Yeah, yeah. And that's one thing that it's important for me to tell women. We do have young women. My youngest woman, girl, is 19 years old. And so I tell women, you always have to be aware of your body and check yourself once a month, a week after your periods, if you're premenopausal, or same time every month if you're postmenopausal. So
Yeah.
yeah, it's important to be
So-
aware of your body.
For a woman who's had a mastectomy,
That's a great
do
question.
I have to keep
No, that's a great question.
feeling on what's left over?
So people
Checking
that have
the
both
tissue?
breast removed,
Uh-huh.
so if you're doing a typical mastectomy, which is different than a subcutaneous mastectomy, so that's done for different procedures, but it used to be the old nipple sparing. They would leave about a centimeter of breast tissue.
Mm-hmm.
Those people still need an annual mammogram. For someone that's had both breasts removed, you do not need any imaging. So just from a screening standpoint, you don't need a mammogram, you don't need an MRI. Once a month, you should still know your body, so still do a checkup, and then once a year, you should have a doctor exam. So you want a physician doing a breast exam once a year, but no imaging, and yes, you still need to know your body and look for changes.
All right, will do.
Good job. Good questions.
you.
Thank you for asking all those questions.
Yeah, thank you.